All right. Love the intro. That was fantastic. Pumped up for today. Everyone, thanks for tuning in. I'm Rob Tatro, president and founder of the Canadian CMV Foundation and CMV Canada. Welcome to all our viewers from across the pond, overseas, south of the border. I'm here in not sunny Winnipeg, Manitoba. Winnipeg's about to get winter. That's how cold it is up here. Negative temperature this week. Celsius, for those of you that are Americans. Thrilled to have on our show today, and I'm going to bring him in right away here. Thrilled to have both Amanda Devereaux and Kim Hill. Let's bring him in right away. As a reminder, guys. Oh, Kim. All right. Kim, Amanda, welcome.
Hello. Thanks for having us.
Oh, we're thrilled to have you, and thank you so much for coming. Those of you that are viewers out there, you're wondering what's happening. This is the second of our CMV Live Public Health and Policy. So remember, the conference was supposed to take place in Ottawa. We had a webinar format for the week that was supposed to happen in Ottawa 2020. We are now building on that momentum, and we're going to have every 2 weeks, Wednesday, noon Eastern, 11 Central. We're going to be doing these CMV Lives with different individuals that were to present at Ottawa 2020. So both Kim and Amanda were supposed to present live in Ottawa, and we got them here today for your viewing pleasure. So we're thrilled to have them. Before I get to them, and before I get to a more formal introduction to them, I do want to thank our sponsors. Couldn't do this without our wonderful sponsors. So obviously we have, CMV Canada. We have Merck, which has been incredibly helpful to us. We also have NCHAM out of the University of Utah. And we have the National CMV Foundation, our partners to the south, who've been wonderful partners since day one. And we're so thrilled to have two individuals today that are going to be speaking on behalf of National CMV and what they've done south of the border. So thank you everyone for tuning in. Every 2 weeks we will be here. So please make sure, if you're watching on YouTube, take a sec to subscribe. If you're watching on Facebook or on any of the other devices, take a sec to like, subscribe, share. Let everyone know that you are watching the CMV Live, and do not miss Ottawa 2021. It's going to be fantastic. The nicest, coolest city you've never been to. If you're an American and you've never been, or if you're a Canadian who's never been, looking forward to having you there. All right, let's introduce Amanda and Kim. So I was lucky enough to meet both Amanda and Kim at some of the conferences that the CMV has, either biannually for the Public Health Policy Conference or the, I think they call it the Global CMV Conference. So I met both of them. Amanda, she's the National CMV Foundation Program Director, Amanda Devereaux. She's worked in public health for 10 years. She worked as a program director for the National CMV Foundation. She became passionate about eliminating CMV when her daughter Pippa was born in 2015. So in 2017, Amanda and her family lobbied for CMV awareness in her home state of Iowa. Iowa has been a mover and shaker for CMV, largely because of Amanda's work. So we're thrilled to have her here. She lives in the wonderful city of Des Moines with her husband, Paul, and her two children. So thanks for being here, Amanda.
Thank you.
All right. I'll give you the mic in a sec, but I do want to introduce Kim Hill. So she's a National CMV Foundation Community Alliance Chair. So she's from North Carolina. Her 11-year-old Caitlin has bilateral sensorineural hearing loss, was affected by CMV 11 years ago, very similar to my son, who was 12 years ago. Passionate about CMV education advocacy, and she's Community Alliance Chair for the foundation. So she also works as a parent educator for North Carolina Division of Public Health, teaching leadership and advocacy skills to parents. Thank you so much. She's got a degree in sociology from Utah State University. We are thrilled to have two wonderful moms that have dedicated a huge portion of their lives to eradicating CMV, to lobbying, to raising awareness. We're thrilled to have you here. You guys are awesome. I've said this before, and I'm going to say it again. You guys are inspiring. Everything that National CMV Foundation does is inspiring. The reach that you have in the U.S., the spread, the dedication of the parents, the different committees, the level of interaction engagement that you have, the lobbying that you've successfully done. I'm so proud of all the work you guys do, and we're thrilled to consider you guys friends and partners. Thank you so much for being here. I will now hand over the microphone to both Amanda and Kim. Looking forward to hearing the chat today.
Thank you so much, Rob. And we are just thrilled to be here, and we feel the same way about you guys. Thank you so much for being our partners in this. And you guys have had so much success also. And we also look to you guys a lot for inspiration. So thank you so much. And I'm just pulling up this spreadsheet here, or this PowerPoint here. I hope everyone can see. And I'm so happy to be here. Like Rob said, I'm the program director for the National CMV Foundation. And I'm presenting with Kim Hill, who is one of our volunteers. And Kim, I'm going to go through this PowerPoint, but please feel free to jump in and add. I know you have some slides at the end, but add tidbits or thoughts or tips that you have while we go through this presentation. Does that sound okay, Kim?
Sounds great.
Okay, so today our topic is really spreading CMV awareness in your area, how you can get involved. Sometimes we hear from people that they want to help, but they just don't know where to start. And so we thought that we would put together just a short presentation for you all about how you can get involved. And then Kim is going to give some of her personal experiences about being one of our official volunteers with the foundation. So we're just going to discuss some strategies to spread CMV awareness in your area, describe some effective ideas for hosting an event in your area. And then we're going to talk a little bit about the program that Kim is a part of with our foundation, the Community Alliance program. And so the first topic is really spreading awareness. This is a picture, I'll refer to this later, but this is a picture of us. We had a CMV Awareness Day in Iowa a few years ago, and this is when we had that declaration signed by the governor in Iowa. So that's just something that we'll talk about coming up in a little bit. So the first tip that I really have is to tell your story. And I think that this is hard for some people, but I think that it's an important first step because I think you want to kind of collect your thoughts as to what has really happened to you and your family and your child. And this is going to be a great way to outreach to people who can help you spread your message. So I would say a great step is to sit down and really take some time to write out your story. You're going to use it over and over again, and then pick out some photos that you think would help tell your story too. People really are drawn to that. They like seeing the photos of the kids who are being impacted and the families who are being impacted. And then you can share this on social media. This is a big step for some people. Some people are a little more private and they don't really share their story widely to begin with. And so if you feel comfortable with that, I think that it's a great way to get some attention to CMV. You can also share with television and print media. And so I have some examples over to the right that people have been involved with in the United States anyway. I had a friend write a great article in the Huffington Post called "Move Over Zika, We Need to Talk About CMV." And that was really great. Got some good awareness out there about the difference between CMV and Zika in terms of the number impacted and also in terms of the media coverage that both have received. And then there was a great New York Times article also. Another idea is to submit to organizations that you are affiliated with. And so some examples are like, we had our story told in my high school magazine that comes out every, I don't know if it's every quarter or every 6 months, but we contacted them and said, hey, would you be willing to do a story on our family? And they were looking for content. I think a lot of times people who are doing newsletters and things like that are looking for content. So that's an idea. Maybe your workplace has a newsletter. There's a picture up to the right of my work's newsletter, my previous job. They are always looking for content, and they did a story that went out to our entire organization. And currently, my husband's work is working on a story on our family for his workplace newsletter. So these are ideas to get the message out. And I would say when reaching out to people, especially reaching out to media, and Kim, feel free to jump in here too, but I think you can really think about who in your area would be really interested. So when I reached out to local media, I thought about some of the news anchors that were moms and had recently had babies. And so as soon as I emailed them and shared like the New York Times article with them, that really resonated with them. So really just think about who you're going to contact. And then another idea is to host a booth or submit a presentation for a conference. And so an example would be there's childcare conferences, nursing conferences, public health conferences. And I know, Kim, you have some experience with this too. So feel free to, and maybe you're going to talk about it coming up too, but if you have any other ideas on that.
One thing that we found really helpful is reaching out to the hearing loss community. For those who have a child that's affected by hearing loss, they're always looking for stories. So we've been able to share her story through a number of different organizations, both statewide and nationwide. And they're just the same thing. They're always looking for family stories, and they've been very, very open and happy to help share some information about CMV.
Awesome. Great idea. Great idea. And another thought I just had too is my background is I'm a nurse. And so that's another avenue, contacting my professional nursing organizations in my state and the nursing conferences in my state. So think about your professional organization, and if it has anything to do with healthcare, they might be really interested in this topic too. So the next tip is to talk with stakeholders. And so we've just kind of listed some examples here, but public health, especially in the United States, we call it the EDDI program, but the entity or the body that handles the newborn hearing screening, they are always very interested in this topic because it impacts so many children, and so many children have hearing loss because of CMV. So get in touch with those people, shoot them an email. Usually you can find the information online. If you can't find the information, we would love to help you with that. You can reach out to medical clinics and medical providers. So talking with even your clinic, your pediatrician's office, and saying, hey, would you be willing to put these brochures in your office, hang up a poster about CMV? So talking to them about that too. Also, therapy clinics, we talked a lot to the physical therapists and occupational therapists that my daughter works with, and we were able to provide some education for them. I mean, not only for people walking into their office, but also for them when they're a provider and they're providing care to children and they're pregnant, they need to know about CMV also. We've done presentations for childcare providers, so you can find local childcare groups or individual childcare providers and offer education to them, offer resources to them. I've definitely done presentations for early intervention. We call it early intervention in the United States. I'm not exactly sure what it's called in Canada, but usually there are people who come see children who are high risk for developmental delay or other special needs, and they will come out and see the family before school starts and make sure that they're getting what they need and hook them up with resources and that type of thing. So we've presented to those groups also so that they know what kiddos with CMV need, but again, also so that they know that they need to be careful when they are pregnant also. And then disability rights groups, those are great groups also. I've spoken at some disability conferences, and we've had Pippa's story featured in a disability newsletter. So those are other groups that are worth reaching out to. And I would just add that during the pandemic, this has all been virtual. And I think a lot of this can still be accomplished virtually. So a lot of the outreach is calling and saying, hey, can I talk to you about this topic? Or can you give me the email address of someone who I can send information to? I just did that the other day. I wanted to make a point to contact my local neonatal intensive care units and make sure that they had our information so that they could connect parents with the foundation if they were diagnosed. And so that was an easy telephone call. So that's a great resource too, is just to call your local NICU and say, hey, who can I give information about CMV to? Kim, do you have any other thoughts on that?
I've recently connected with, there's a family advisory board at our children's hospital. And I joined the board, and that's been a great opportunity. And there's often opportunities to talk to new groups of residents coming in or nursing students that are starting out. Right now, due to COVID, it's harder to go in to speak, but they're starting to do things virtually. And they've set up like one-on-one conversations with students and parents, which would be a great way to kind of connect really like in depth with, even if it's just one person, somebody that's going to be, in this field and working for years, and give them such a great background on CMV. So that's been really helpful for us. And same as you said, a lot of our providers, the early intervention, have been really open to learning more about this as well.
Absolutely. Yes. Awesome. So another thing that people can do, and sometimes this is the first thing people think of, but it does not have to be the first thing that you think of. There are a lot of ways to get involved without taking this step if this step isn't something that you're interested in, but you can talk to your legislators. So again, you're going to use that story that you have written out and use pictures. Legislators love seeing pictures of kiddos. If I have a picture attached to an email I send to a legislator, I get a response much more often than if I don't. And sometimes they just write back to say, what a cute picture. So at least I know they read it then. So I think that that's something that's really important. And we're going to do more presentations on this and more specific ideas for legislation. But just for some basic tips, definitely share your story, use the pictures, tell the legislators what you want. And you can give them a template of, a state or a provincial law that has been passed that they can work from. And then really ask for help from people who've been successful. In the United States, we have, oh gosh, I don't know how many anymore off the top of my head, at least a dozen, I think more than that, states who have passed some form of CMV legislation. So please reach out. We'd love to help with this and give you more ideas that we just don't have time to cover today. And then another idea is to host an event or fundraiser. And so this is also something that can be a little hard for people to take the first step to do, but it really can be simple. It does not have to be something huge, especially the first time that you're doing it. So really decide on an objective for your event. Are you trying to raise funds? Are you trying to spread awareness? Are you going to do both? And a lot of times you are doing both, even if your primary focus is one or the other. And then you want to choose an event that really interests you. You don't want to be planning something that you have absolutely no interest in, that you're not going to find fun. And think about something that's realistic. I hosted a 5K for the first time in 2019. And that was my first time hosting an event like this. And I knew that I really maybe wasn't going to be able to get it done in my hometown. And so we decided to make it more of a regional or a bigger event, and we moved it to a bigger city in a neighboring state where I knew that there was a bigger CMV group. So that was what was realistic. So really think about what's going to work best for you. You want to plan early. You want to recruit a team or a committee to help you. And maybe the first year it's only a couple people or family members, but it will grow as the event grows. And if you reach out to the Foundation's CMV Canada or National CMV Foundation, we'd love to help you find families in your area if you are not aware of any. We do have a limited list of people, and we can always ask for permission to share their information. So like I said also earlier, think about your entire state. It doesn't have to be just your city, but think about your state or your region for an event so that you have more people to draw on. Connecting with other CMV parents, we talked about that. Thinking about other organizations in your area who might be interested. An example here would be the National Center for Deafblindness. That's an organization that has a similar audience. And so they might be willing to partner up for an event or maybe even promote your event. So that's a great way to increase awareness. And then you can leverage activities that you're already a part of. So maybe, like Kim said earlier, maybe you're involved with the hearing loss group in your state. And so maybe that's an activity where you can kind of, work together. So there's great partnership with the Hearing Loss Association of America, and there's walks all over the country, and we can kind of work together to raise funds for both at the same time. And so that's a good example of working with an activity that you're already involved with. And really keep it simple. It does not have to be something big and complex, especially the first year or the first few years. It can be whatever you want it to be. We have people who are planning everything from large golf tournaments all the way to online challenge. They're doing a series of online challenges and they're raising money that way. So there's really simple ways to do this. Kim, do you have anything to add on that one? Or are you going to talk about that coming up?
We'll talk about it later.
Okay, cool. Sounds good. I'm trying to hurry because I feel like we're already short on time. These are just some event ideas. I'm not going to go through them all because, again, we're so short on time, but just wanted to point out some of our more popular ones. I would say walks and runs are really popular. Facebook fundraisers are huge. I mean, even just hosting a Facebook fundraiser for your birthday gets a tremendous amount of funding for CMV Canada and for National CMV Foundation. And they don't take out any fees. It's amazing. It's one of the wonderful things about Facebook is all of the money donated goes right to the foundation. So that's a great way to do that. And then a couple pictures here of just speaking at conferences and having a booth at a conference. Those are some ways that people get involved. And then, like I mentioned earlier, you can have an awareness day in your state. I know that this is true for the United States. I'm not sure about Canada, but usually it's just a simple form, and it could be different in each state. But a lot of times it's a pretty simple process. You've got to fill something out, tell the state what you want the proclamation to say, and then the governor signs it on a certain day, and that's Awareness Day in your state. And then just real briefly, I want to talk a little bit about our CMV Community Alliance program. We call it the CCA program. Currently, we have 11 parents who are official volunteers with us, and they are really our ambassadors in their state or region. And so what they're going to do is they're going to work on increasing CMV awareness, maybe do some fundraising, maybe advocate for legislation, but they really get to work with staff at National CMV and come up with a plan for their year and set some goals. And we really work with them to try and help support that. And so what we provide is staff support. That's one of my jobs as program director, is to support these wonderful people doing this work for us. We provide monthly conference calls where we do brainstorming, or we offer trainings, and we go over educational resources. And so this is a program that we're hoping to expand. Like I said, currently we have 11 members, but hopefully someday we'll have a CCA chair in every single state. And we would love to see that happen. So this is a program that people can keep their eye on, and hopefully we will see it grow soon. And speaking of our wonderful CCA program, we are going to look at some of their past activities. So people have run marathons to raise funds, hosted 5Ks, done the Walk for Hearing, all sorts of other wonderful activities. And so we are going to hear from Kim Hill, who is in her second year as one of our Community Alliance chairs for North Carolina. And there you go, Kim. Just let me know when you want me to advance the slide.
Perfect. All right, I will just jump right in the interest of time. So I've been able to do a number of awareness events since joining and becoming a CCA. And this is one that I did here in Raleigh, North Carolina, where I live. And this was a neonatal conference for nurses. And I did it with 2 other local CMV moms, and we were able to be there for 2 full days and just have a lot of conversations with these nurses. And most of them had heard of CMV, but most didn't know how congenital CMV would affect a baby for the rest of their life, and kind of the implications that could be associated with it. And so talking with those nurses, and especially having these other moms with me, where we all have different stories. We all had different, some of us had symptomatic babies at the beginning, some of the babies were asymptomatic. Just having those different perspectives and showing kind of the wide range of how children can be affected was really, really helpful. And a lot of the nurses didn't know about hearing and how hearing could be affected and how hearing loss could occur later. So just kind of having those conversations with these nurses that spend time with these families at the beginning was really helpful. So this is one of probably my favorite awareness events that I've done. And every nurse had to stop by our table. They had to fill out a little form to be entered into a drawing. So we really talked to almost every nurse there, and it was great. So that was a good opportunity. There was a small cost associated with it, but they were really welcoming and happy to have us. So that was a great event. All right, next slide.
Okay.
This is, we did a walk for hearing last fall, and we had so much fun, and we were able to pull in some other CMV families and some friends of ours, and we had a great time just connecting with those other families and coming together. The foundation sent us shirts, which was great. That was so helpful because there was more than is pictured here. We had quite a big team, and so just having these shirts there started a lot of conversations, and we just were well represented. And I think something as simple as shirts really made a big difference. And we were able to. This was the first year that the CMV Foundation teamed up with Walk for Hearing, and it was good to kind of connect with the Hearing Loss Association of America, is who does the Walk for Hearing. So connecting with them and getting CMV kind of on their radar was really, really a benefit, I think, going forward. And we're sad we can't meet in person this year, but we're hopeful that next year we can do this again, because it was great. My Caitlin is up there with the little cochlear koala, and she loved this walk and getting to meet new friends, and it was great. I love the family outreach part of the organization and getting to know other families. It also worked as a fundraiser, which was really great. It was simple. It was a simple way to raise funds because the Walk for Hearing manages all of the logistics. And it was just a good day for our whole family, and we had a great time. We've also done a couple restaurant fundraisers as well that were fun and simple, and really you do a little bit of work in the beginning and then you just kind of show up and the restaurant handles the rest of it. So those are some simple fundraising things that we've done. All right,
Awesome.
next slide. And just kind of locally reaching out to families and working within kind of other organizations that exist. I have just a group of all the parents that I know from North Carolina in a group on Facebook Messenger. So it doesn't capture everybody. It only captures the ones that I know or have connected with on Facebook. But we've got probably 20, 30 families in there. And so it's easy anytime we had like the walk or anytime we have anything going on, I can just message that group and connect really quickly with a whole lot of families. One thing we did this year is I connected with that group to get some stories that we put into weekly newsletters that we sent out through EDDI, the Early Hearing Detection and Intervention group for our state. And so that was great. It's great to connect with those families that way. And I have been able to do quite a bit of work with EDDI, and they've been really, really supportive. This is a picture of our CMV work group that is headed by our EDDI coordinator in our state. And we did this picture in June on Zoom, as we couldn't meet in person in any way, but we did this picture and sent it out through those newsletters. And EDDI has been great to work with. They've allowed just a lot of opportunities to speak to different groups and just talk about hearing loss and CMV and how it has affected our family. And that's been really helpful. I also work within our health department as a parent educator, and going and meeting other families has been wonderful. And there's been a couple times where I'm meeting with a mom and she said, oh, I have another mom that I know has a child with CMV. And so just connecting with these parents, whether they have a child with CMV or not, has really helped just pull in my network of resources throughout my state and other parents that can help just kind of in this world and in this journey. All right, next slide.
Awesome.
And then just another thing that I've been able to access through this program is just my own education. And I was able last spring to go to the International CMV Conference in Birmingham, Alabama, and the National CMV Foundation sponsored that trip. And it was just like so much information about CMV. Just I learned so much. There's just so much. It's a little different than the policy conference. It's more just science and information about the virus and things that I just hadn't known or knew things that they found. And so having that opportunity to get that information and then be able to bring it back to North Carolina, to the families and the organizations that I work here, was really great. And connecting with, these are some other moms, just connecting with other moms and dads and grandparents and people associated with these kids, and just talking with them and networking with them and finding what their states have done or what they've done for fundraising has just been invaluable. And the trainings that we do as well, we have we have monthly webinars and we have trainings. And so just getting ideas about fundraising or the science of the virus and just learning more has been super helpful. So I'm very grateful for this program, and I'm happy to be able to work with the program, and it very much complements what I'm doing in my life here.
Awesome. Thank you, Kim.
You're welcome.
And we are at the end of the presentation. I think one final thought I would just like to say is if people are looking to get involved and they still are just, hesitant or having trouble taking that first step, reach out to, National CMV or to CMV Canada and let them know that you want to help and you just don't know where to start. We would love to help you with that. We'd love to connect you with someone who's done something similar to what you want to do. And that's really our mission is to help you guys with these grassroots efforts. So, and with that, I am done.
All right. Well, thank you so much, Kim and Amanda. That was just so many fantastic ideas. There's so many good takeaways. They don't all need to be the $1 million fundraiser idea tomorrow. I think of when I started in Canada about 10 years ago and I did my first event. We had maybe 80 people, 100 people. We raised like, a few $1,000s and, a few media articles about it. It's very, very small. But over time, that thing grew. And, now, we raise $100,000 every year with that event, Le Classique. And it's Western Canada's largest outdoor ball hockey tournament. Now, I didn't know what I wanted to do back then. I didn't know how big it would get. I just wanted to let a few people know about CMV. And our idea was ball hockey tournament in the middle of winter, the coldest city on the planet. So you would think that wouldn't work, right? But it ended up working out great. And I think of all the ideas that you have here, some takeaways, it doesn't need to be everything tomorrow. Start slow, reach out, ask for advice. If you want to lobby, great. But if you don't, you can also do events. You could also do awareness. And on the lobbying side, tell your story and don't take no for an answer. Okay. So on the lobbying side, I love that part about that. You guys have done this so well. And we've had some success in Canada as well. Parents can do it, right? We as parents, we can say, no, that's not fair. BS, we're not accepting that. We need more. We need to know. And you can be crazy, right? It's fine. We're parents. We're passionate. We care. They're our kids, right? Whereby if you're on the medical practitioner side or medical health provider side, you can't just kind of be crazy, right? So I'm fine with being incredibly passionate and not taking no for an answer. And that's how we got it done in my home province. We got, a full targeted screening protocol passed. We're now looking at universal screening in my home province. In the province next door in Ontario, we have universal screening now, and it's all parent driven. So I'm so thankful that you guys were here today to tell the success that has been the US story. You guys are continuously knocking on doors and making things happen. If you're a parent, you want to get involved, you don't need to be on the board tomorrow. You could start slow. If you want to be deeply involved and you want to start lobbying and you want to, that's great too. We would love to have you on board. So for us, check the ticker at the bottom or go to our Facebook page for National CMV Foundation in the US. Do the same. We need you guys. We can't do it without you. So incredibly thankful to all the parents that have given some time. Quick thanks again to Merck and Cham, National CMV Foundation and CMV Canada. We can't do this without you. 2 weeks from today, we have Marie Pigeon. Marie Pigeon is going to be 12:30 Eastern time. She's on the Ontario Infant Hearing board. She's the one who was instrumental in getting universal screening passed in Ontario. And they did it kind of through a really neat avenue. And she'll tell that story next week. She's an audiologist. 2 weeks after that, we have Isabelle Boucarin. She is an obstetrician gynecologist that'll be telling the story of what's happening in Quebec, La Belle Province, the French province. She's fantastic. These two women are incredibly passionate about what they do, and we're thrilled to have them on the CMV Live. We'll stop it there. Ladies, anything else you'd like to add?
No, just thanks for having us.
All right.
Thanks for having
thank you. We're thanking you, and we're wishing everyone a great rest of the way, a great rest of the day and the rest of the way, and a lovely month of October, which starts tomorrow. Thanks. We'll see you in 2 weeks.